Robin Williams' death shedding new light on how we deal with mental health.
After the break, we're talking about depression tonight, the warning signs and what you can do to help somebody.
Thank you so much for this incredible honor. Thank you for putting me in a category with these four extraordinary men. Thank you, Ben and Matt. I still want to see some ID.
You know, both Matt Damon and Ben Affleck saying that they owe him their careers, essentially. Robin Williams, his death, a shock to all of us. The well-known actor and comedian battled depression and addiction, and his suicide kickstarting a much-needed conversation on mental health. And joining us, Dr. Ben Baechler with U of M, a family medicine physician, to talk about depression and the warning signs. And this is an important topic. A lot of people talking about this today. And what are the warning signs, and how can we help somebody in our family or close to us?
Well, I think this example with Robin truly speaks to the power of this disease and the greater sense and need for awareness amongst all of us. When it comes to the warning signs and symptoms, think of a dial on a radio. It can go from very soft to very loud in terms of what we notice. More mild signs and symptoms would be an individual who has difficulty concentrating, a low sense of energy, difficulty sleeping, indecisiveness, restlessness, agitated. And it can grow more severe. An individual who is missing work, who's just completely sleeping the day away, an individual who's making statements of I would be better off if I weren't in this world, the world would be better off without me, cries for help. So it really is a wide gamut.
And so what can somebody do to help somebody through this, and what types of treatments are out there?
You bet. Well, when it comes to family members, say if you have a brother or sister or a spouse who is depressed, the number one thing we can do is to have patience and understanding, and to also remove the stereotype in our own mind of what depression looks like, and to be open to having conversations. In terms of what we can do and what treatments exist, the most important thing for the viewers to realize, it is a multi-modality approach. It's simply not a pill. And in fact, there are studies that show that everyday exercise is as effective as an antidepressant for mild to moderate depression. And so it's exercise, it's diet, it's stress management, it's what we eat, it's the right medication at the right time for the right patient, and it's family having an open discussion.
It seems like the more we learn about depression, the more we learn how complicated it is. So are we any better at getting some answers to all of this?
We are better at the detection of depression. We're doing many screenings in primary care centers and clinics. When individuals come in, it's actually being a major part of the screening emphasis in primary care clinics. And when it comes to the treatment, we are getting better. We have interventions that are working better than in the past, and we're coming to understand that it's more that broad spectrum approach that truly provides the best result for patients.
And the last question here, people talking about heart surgeries and heart disease and that connection to depression as well. He had a heart surgery just a few years ago. And what happens to some people after they undergo something like that?
There are certain conditions where individuals can have an increase in the rate of depression after certain procedures. Interestingly enough, the data shows individuals who undergo a cardiac procedures or a heart attack have higher rates of depression. And so family members, friends need to be aware and be on the lookout for an individual they care about if they've gone through a cardiac procedure or heart attack, and look for signs and symptoms for that, and for an individual themselves to be on the lookout.
Pay attention, don't be passive if you see this in your family or
and,
around you.
And have the conversation, and just ask someone, reach out. It seems you're having a hard time. Are you okay? Simply asking that and not being afraid to broach the subject with a neighbor or a friend or a coworker can make all the difference.
All right. Dr. Ben Baechler, thank you so much. Family Medicine with the U of M. We appreciate your insight every time you come in here. Thank you.
Thank you.